Yesterday, ANVISA published a new regulation about the cannabis-based products, so it rules the medicinal use of cannabis in Brazil. I'm going to address you the key points of this new act from ANVISA that is called RDC 327-2019. So I will do this in the, like the news TV. I will read from time to time because we're talking about 78 different articles in this new legislation. And aside of this new legislation, we also have to use another 14 existing legislations in order to prepare and submit the technical dossiers, okay? So in this moment, ANVISA will authorize the commercialization of products that can be used with administration by oral or by nose administration, so spray or something like this, and capsules and stuff. Any other way of pharmaceutical administration will not be used in Brazil, so not injectables or something like this, or topic use or whatever. The product must be recognized by the regulatory authority in the country of origin. So if you want to export products to Brazil, this product must be, first of all, recognized by your own regulatory authority in the country of origin, FDA or European authority or Ministry of Health, whatever is the health authority in your country that deals with the registration of products. Brazil will not authorize the importation of the plant itself or parts of the plant, even if these parts are dried, smashed, whatever. Brazil will only authorize the importation of finished products or APIs. It's also important to say that the products cannot be sold in Brazil under a commercial name. That there will be written in the label, cannabis-based product, lot number, manufacturing date, expiring date, and the barcode that has to be in the GTIN system, what means 13 algorithms that will give all the full traceability of the product from the raw material to the finished product, okay? If the product has different concentrations, so we have to submit each one of these concentrations individually. It's not allowed by ANVISA in this moment to make one submission for various concentrations. It's also important to know that the quality control of the product must be done, excuse me, in the Brazilian territory. So it has to be done by the importer of the finished product or by the local manufacturer that will buy the API from your company and will make the finished product in Brazil. Nevertheless, this quality control can be 100% outsourced in laboratories that are recognized by ANVISA. As you know, ANVISA is the Brazilian regulatory authority, okay? The company that wants to hold this registration in Brazil needs to have the working permit from ANVISA as for pharmaceutical products, as well as another working permit for controlled substances. So we are talking here about two different working permits from ANVISA. One for pharmaceutical products, another one for controlled products, for prescription products, okay? These products that are cannabis-based products, they will fall in the category of prescription products, controlled products in Brazil. There will be no OTC. In this moment, no OTC cannabis-based product can be sold in Brazil. So, okay. Obviously, there is a series of documents that need to be sent to ANVISA to prepare, so to base this dossier that will be prepared. And later on today, we will release a document in our website, www.latinigroup.com, and you may download this document later on today in English explaining what kind of documents will be needed from your side to make the registration of the products in Brazil. Finally, the product can only be prescribed by doctors, by physicians. No other category of professionals in Brazil, like nurses or pharmacists, may be able to prescribe the product. The product can be delivered only in pharmacies or drugstores, but no handling of the product will be allowed. So it means that a handling pharmacy cannot import the API to make the product, per patient. It needs to be an industrialized product, okay, in its finished formula. And finally, but not less important, the importation of these products in its finished form or finished product or API must follow the same procedures that we follow today for products like morphine or any other controlled substance. Okay, so the importer in Brazil will know about that. You don't have in your foreign countries, you don't have to be scared about that. Finally, and not less important, once the authorization for the commercialization of the product is granted by ANVISA, the holder of the registration in Brazil will have to import or will have to industrialize the product and sell this product within 365 days, counting from the day of this authorization. Otherwise, ANVISA will cancel this existing authorization for the commercialization. In a matter of fact, just to finish the final comment, ANVISA in the first moment they will grant an authorization for commercialization, and later on the companies will have 5 years to submit the documentation for product registration. If the companies don't do this in the next 5 years, this authorization for commercialization will be lost, and then they will have to start all over again. Okay? Our team here in Brazil is at your disposition, to clarify any remaining doubts. You may contact us using our website, as I said before, latinigroup.com, and we will be glad to answer any remaining doubt you may have. Thank you so much for your attention, and later on today, please download the white paper we're going to release regarding the key points of this new legislation. Thank you so much. Bye-bye.